Hey guys, my name is Veronica. I'm in Group B, so today we're going to be talking about the ligaments of the knee joint. So you have your external or extracapsular ligaments and your internal or intra-articular ligaments. So for the external one, you have two main ones. You have your patellar ligament and then your collateral ligaments, which includes the medial and lateral collateral ligaments. So for patellar, that one's mainly going to serve as like a stabilization for your patella, which is connected to the quadriceps tendon. And then you have your collateral, which is the MCL and the LCL. So those two we hear about more often. So MCL, which also stands for your medial collateral ligament, it's going to want to stay medial, okay? So it's also called TCL because when you go down the medial aspect of your leg, you have the tibia, so also TCL. But anyways, so you have your medial collateral ligament. It's going to want to stay medial, right? It's not going to want to move anywhere else, so it's going to resist abduction, okay? It's going to resist any movement going away. And the MCL is weaker than your LCL, so keep that in mind. And then next we have your LCL, which is the lateral collateral ligament, or FCL, because again, if you go down the leg on the lateral aspect, you have your fibula. So the LCL is going to want to stay lateral. Okay, it's not going to want to go inwards, right? It's going to want to stay lateral. So your LCL is going to resist adduction. Just think about MCL and LCL, what position they're in, and how it wants to stay in that position. So you have the valgus and varus stress test, which those two basically you're applying pressure on the thigh and the lower leg or ankle, and you're wanting to apply pressure to see whether, depending on what direction of force you're wanting to generate, to see if someone has an MCL or an LCL tear. Now for the internal side of things, you have your menisci, which main thing is that it absorbs shock, so it's between like your knee joint and everything. It's going to absorb shock, for example, like if you're jumping. And then of course with the menisci, you have the medial and lateral side. But then going down, you have your cruciate ligaments. So your ACL and your PCL. Biggest thing to remember, ACL, just think anterior, right? This is your knee, so it's going to want to prevent hyperextension, whereas your PCL, it's going to want to prevent hyperflexion, that posterior going back. And of course, your PCL is going to be stronger. And then, of course, if you want to see if there's damage to the ACL or PCL, you have the Jor test, and that's basically, you're pushing anterior, posterior to see which ligament is affected. So, if someone has an injury, let's say they get knocked to the medial aspect of their knee, what test would you do for what exactly? Thank you.